Thank you, Mario, for helping us there. We've turned off the TVs and we sorted out the echo. Everybody, welcome to February Health in Hackney. I'm joined here in the chamber by Cllr Snell. I've had apologies for absence from Cllr David and Cllr Pluvier, and for lateness from Cllr Adams. Technically, I think it requires 3 of us to be here to make this meeting core. At the moment, there's only 2. We'll start, and then we will technically become core when Cllr Adams joins. Doesn't really matter, only for approving the minutes. Just a few matters of housekeeping. This is a hybrid meeting. We have some members online and guests, some in the chamber. It's being live streamed, it's being recorded. Members of the press may be watching. Please keep your microphones on mute unless when you're speaking. Please keep your cameras on. Please don't start chats in the conversation bar. I haven't been notified of any declarations of interest. I think we take Cllr Snell's as a red and standard one. And so with that, I want to move to the first substantive item we have today, which is the Kings Park Moving Together project. We were due to have this, I think, last month, but it got adjourned to this month. Welcome, Lola Akindoyin, who's the head of the programme. Welcome to Warren Leigh from Sports England, and Jeanna Brodie-Mends Sanderson, who's one of the coach at one of the providers. You've got a helpful presentation in the pack. Lola, shall I start off with you to give us an introduction? We've got half an hour for this, maybe 5 to 10 minutes, and then we'll throw it open for questions.
Okay, thank you very much, Councillor Hayhurst, and good evening, everyone. I'm Lola Akindoyin, and I'm the head of programme for Kings Park Moving Together. And the presentation that I've provided gives you an outline of sort of some of the work that we've been doing, the rationale behind the programme, and some of the things that have impacted, or the way the programme has changed as a result of the pandemic. So if I could just start by providing a little bit of context, and I'd also like to bring in Warren from Sport England to just explain Sport England's ambitions with this programme. But just to say that, Hackney is one of 12 pilots across the country, with a focus on essentially supporting people who are least likely to be active, and to really encourage physical activity as a way of improving health. Now, one of the things about the programme is that we're trying to do almost 2 things simultaneously. We are testing and we are learning. We are trying to influence behaviour, and we're also trying to influence the way that wider systems and structures support people to be more active. So it's been a really interesting journey in terms of the sort of range of stakeholders that we're working with, but first and foremost, really ensuring that we are approaching this work in a way that puts the community at the heart of what we're doing, that seeks to collaborate and co-design. And whilst that's provided some fantastic opportunities, I think also it's fair to say that there have also been some challenges and difficulties that we've worked through along the way. Kings Park is in the east of the borough, and is has 2 large housing estates, Kingsmead and Clapton Park, and is a little bit kind of geographically isolated. And I'll also bring Jeanna in a while to just talk a bit about the importance of having local provision and connecting with local grassroots and voluntary sector organisations. But before I go any further, I think maybe it might be helpful for Warren to just set that broader context in relation to what Sport England are seeking to achieve with the programme, and then I'll add some additional things.
Thanks, Lola, and good evening, everybody. Thanks for inviting me to the commission this evening. Just by way of introduction, I'm Warren Leigh I'm a strategic lead at Sport England. I've been with Sport England for 2 years now. And one of my roles at Sport England is to work with 3 of the local delivery pilots. So along with Hackney, there's also pilots in Southall and in Essex, and obviously another 9 in other areas of the country. Just for some of that additional context, we've been working so long with the local delivery pilots, this actually emerged from our previous strategy cycle towards an active nation. And it was really in a recognition of the fact that although activity levels, as we measure in our active life survey, we're inching up kind of year by year pre-pandemic, it wasn't going fast enough, and certainly the people who, as Lola said, were inactive were proving very difficult to move. That percentage was not going in the right direction quickly enough. And it was also a recognition that a lot of Sport England's funding had been on successful but individual short-term projects based on a particular theme. And what we wanted to try was really doing something different. So that was around selecting places to work on a much deeper, much more long-term basis. And rather than saying, we want to work with you and tackle X in your place, it was about saying, okay, we want to work with you, but we're not coming with a top-down set of criteria about what we want to work with each of these places on. We want to work with you to understand what's important to local communities, what you feel will work in your area, that will maybe have more success than we've had on some of the kind of the more short-term pieces. So that was in 2016. I think the pilots were selected in 2017. So we're kind of 5 years into that work. And all of the pilots are funded till 2025. So we're talking an 8-year relationship. We don't anticipate a drawbridge coming down and that relationship stopping in 2025. But yeah, it's much more of a kind of a long-term way than we've ever worked with places. And for us, it's really about learning how do you build in physical activity into all elements of the system in a place, so that it's not just the sport and recreations team, it's everyone's responsibility or in that place, or what matters in that place to make that contribution. So that's where we are. I'll stop there because I'm sure that will allow lots of time for questions, but hopefully that's some helpful context.
Thank you. So if I could just explain a bit about the work that we've been doing. It has very much started with connecting with local residents and also local partners, voluntary sector organisations, doing lots of mapping, lots of conversations, and really building trust and relationships. And I think that's been really key in terms of, the approach has not been about going in with a prescriptive way of doing this work. It's been about going in to do quite a lot of community listening, really understanding the barriers that people face in relation to being active. And as I'm sure you can imagine, they are quite broad. People have all, lives are all different, we're all different individuals. But there have definitely been some common themes that have come through, both in terms of the barriers, but also the opportunities in Kings Park. So some of the barriers have been, the usual things that we would expect: time, people, their ability to find time to do something in addition to what their daily lives entail has meant that very much we're looking at embedding things in their day-to-day lives rather than asking them to do something separate. Caring responsibilities has been really high. So whether that be caring for children or caring for relatives, family, friends, pressures I've already mentioned on time, but also the cost of potential activities. So again, we understand that, for some people, being able to pay to go to something is really difficult. However, the flip side of that has been that we've really heard from people about how much they value their green space. And actually we heard about that a lot, even before the pandemic, but since the pandemic, that has absolutely increased. So people do see that as an opportunity, but at the same time, people have talked about concerns around safety. So, the link between the public realm, physical activity, being in a place. So therefore, it's been really important for us to work with Clapton Park TMO, to also try and work with Sanctuary Housing to think about kind of that broader public realm situation. But then also, in addition to that, people have really emphasised the importance of quite local provision. So again, just in terms of thinking about how community spaces are utilised in the area, there is a lot of community space in Kings Park, but also the challenges about actually how do you enable things to happen in a way that can remain very grassroots, that also can be low cost, and that also can be accessible. So as we've been through this work and connected with a range of people, we have been really fortunate to connect with a range of really passionate providers, because the other thing we know is that we need a really diverse offer to respond to the range of needs in the area. And we met Jeanna and kind of made contact with Journey Before Success, who it's been an interesting journey because we started on one particular project, but actually that's evolved over time. And Jeanna, if I could bring you in now to sort of just explain your experience of working in the community, but the project that you've been working on with the women in Kings Park and where that's now led to.
Evening all. As mentioned, my name is Jeanna Brodie-Mends Sanderson and I'm the Managing Director of Journey Before Success. I'm also a strategic coach and I'm also a qualified and registered social worker. I thought it would be good to let you know in terms of my qualifications. It helps give a bit more understanding as to how, as providing the service, the reasons how we're able to take a holistic approach to supporting the women in our groups. So as Lola has mentioned, pre-COVID, everybody would like, people would love to have the opportunity to go out and walk and enjoy the spaces that we're in Hackney. As we know, there's a lot of beautiful spaces, but then safety was always an issue. People would want to go to the gym. Often, though, you tend to find that women, I'm not going to say that's a blanket thing, but women tend to be the ones that are looking after the children, looking after the home, whilst also going to work. So it's very little time for them to be able to focus on themselves. There was family issues when it comes to stressful relationships as well. What we found by offering a walking group, that there was a common theme that women can support each other. We've been able to come together over, I think initially it was 12 weeks in May that we started the project. Because there was other groups in the area, but yeah, we won't secret that. So on our walking group, we meet up on a Wednesday, 6 till 7:30. The overall goal is to encourage women to take part in the activity to improve their overall health and well-being. And in doing that, initially they wasn't too sure because we would walk through the forest, we would go down by the canal, and a lot of the women that attend are predominantly from ethnic groups, predominantly African Caribbean groups. We have some that are Eastern European, mainly from the other group is Eastern European, and a couple of people from Asian communities. But often what was the feedback that we got was that they didn't see themselves in those spaces. So they didn't necessarily always feel quite comfortable to be in those spaces. So us going out as a group gave them that additional support and encouragement to do that. We would have on average, let's say 12, 15 people each week turn up to go out on the walk. Across the board within the first quarter, so let's say from April, May, June, we had about 25 people sign up, which was really good considering they had never gone out and walked before. We showed them a lot of routes that they could do additionally when the group wasn't happening. So they was developing that form of independency. So they wasn't about them only turning up and having that physical activity when we were on, because we're only doing it once a week. And we were trying to advocate for them to continue doing it, but feeling comfortable in their own spaces as well. Then that has now exceeded to, we've had about 40, now we're probably about 65 people across the last couple of quarters that have now signed up. Again, we thought coming up to the winter period, people was going to drop off because people say it's too dark, it's too cold. But actually, on average, we had between 9 participants turn up every week to go out regardless, because they appreciated going out, and going for the walk, because it gave them more than just the walk. The routes that we planned were simple enough that any level of physical activity, anyone can take part. So whether they'd never gone to the gym before, never exercised, mobility reduced, there was always a way that someone could take part. And the project's called My Sister's Keeper. So there's always someone, there's at least 2 people walking alongside each other. So if you're more advanced, they would go on ahead, but there's always someone either behind, in the middle, and at front. So there's those that might want to be pushed a bit further, as well as those that want to take it a bit slower. All of those things are taken into consideration. Following on from that and how the success of that throughout the summer, we then partnered with or collaborated with GLL, and they offered a program of healthy living together. It's a Healthier Together program. So we've been able to offer that service to people within the community of both Kings Park and Clapton Park, the opportunity to have like a GP referral scheme. So they had access to the gym for free for 12 weeks and attended education sessions each Monday for 12 weeks. That has been amazing. The women have really enjoyed that. We had 15 women, we had 23 sign up, 16 people actively took part and completed it. We had 15 women and 1 male that took part in that first round. They've really enjoyed the engagement. The lessons that they've learned from that education, that combined with what we do on a Wednesday, that provided additional support. And it really showed them there was discussion being had from the Monday class, and it was nice to see the continuation of what they learned on a Monday and how they can implement it, and then they're explaining how they've implemented it throughout the week, and then to see the results. Previously, through discussions with Kings Park, there's always been a key talking about consistency, because too often you may get funding for short periods of time and then it stops. But because we've been going on for at least, let's say now, going up to 3/4 of working with them. But my background is I've worked in Hackney within the community for 17 years. So knowing that we're not offering a service because we just want to get a quick fix, and that we're just trying to, quickly get some stats and then we're going to disappear. It's about consistency and longevity, and also equipping them with the tools and the skills that they need to continue it on their own. And yeah, it's been going amazingly well. We do also offer a female empowerment session on the Thursday. So that's skipping for physical activity. So we're trying to hit the different generations. So we're working on preventative as well as responding to people's needs and that they have now. And yeah, it's been amazingly well received, and people are looking forward to doing another round of the Healthy Living Together and continuing to join our walking groups on Wednesday. Like, they're out now. I'm looking at the time, they should be wrapping up in about 10 minutes. And as I said, regardless of if it's raining, it's really cold, they wrap up and we just alternate the routes accordingly.
Great. Thanks, Jeanna. That's really fascinating to hear. Lola, can I ask, how many providers are there, such as Jeanna's, who are providing services?
So it does sort of change over time. So as our sort of different funding streams are live, then we have a sort of an increased number. So we've worked with, over the period that we've been running so far, we've worked with a good sort of 15 to 20 different providers. So at the moment, for example, we've got a partnership with British Cycling and the Pedro Club, and also British Cycling have been working in local schools. So I think what we've really found has been the importance of having kind of lots of leads, lots of different things happening at the same time, to sort of try and reach as many people as possible. But equally, we have been on a journey with the funding and with the relationships with some of the providers, and we're at the point now where the learning that we've had has really identified the need for us to strengthen the capacity of a range of providers to provide physical, support to help people be active. And so we're about to go into a funding round where we're going to work with a cohort of organisations. So organisations that might not necessarily be physical activity providers, organisations that, like Journey Before Success, might be doing something that's more holistic, but actually really have a passion and interest to support local people to be more active, but just need some additional capacity, need connecting into different other providers, need training, need support. And that will be a cohort of about 10 organisations that will work across the Hackney Marshes neighbourhood. So it also kind of is aligned to their primary care network.
And is the principal sort of group that you're looking at those that wouldn't have done any activity before this, or is it also a bit broader than that, towards that some may have done a bit of physical activity to get them to do more, and also looking at, it's a younger generation, to embed that as cultural habits? I mean, is it across all those different areas?
Sure. So because in Hackney the decision was made to take a particular ward and to focus on that ward, we are trying to look at a whole population approach in Kings Park. But our focus really is people who are inactive, those who are not doing the kind of public health recommended amount of physical activity each week. Now, we also have people who are lapsed inactive, as we might say, so people who in the past perhaps would have had a physical activity journey or been, would have deemed themselves to be active. But again, life changes. So people have children, jobs change, people become unwell. So all of those things mean that actually there are some people that want some support to find their way back to being active. But our main focus is absolutely people who are inactive.
Thanks. Members, any questions? Councillor Oguzkanli? You can use the microphone if you can.
Thank you, Chair. My question was about the community insight section of your report does talk about some of the concerns raised by the residents about facilities in the park. It is obviously directly connected, the use of outside space in parks and how those facilities are there for people to enjoy and use as and when they need to. In terms of the facilities, in particular toilets and food establishments, are you satisfied what is there at the moment? Does satisfy the residents, and what kind of improvements have been done to those facilities to make sure that everyone at all age groups can access and benefit from those facilities?
Thank you. So we have two capital projects within the Kings Park Moving Together programme. One of them is a project that is focused on Dalbany Fields and developing, providing opportunities for people to be more active. And absolutely that kind of supported infrastructure has come up again. And the other one is connected to the Pedro Club, which is about trying to open up and improve a facility that could be used for local people. Now, I wish I could sit here and say that the issue around access to public toilets is an easy one to resolve. And unfortunately, we don't have an answer to that as yet, but we are absolutely seeking to work with colleagues in a range of different departments to think about how we may be able to respond to that. And that is, and that is thinking about the area in its broadest context. One of the things that I think is really interesting about this programme is absolutely the range of partners and internal colleagues that we're working with. So also, I'd say a key contact that we often engage in this work is colleagues in regeneration, because actually when we look at physical activity and we look at things like community development, it's all really interlinked. So colleagues in regen have been really important in terms of helping us to think about the area and the range of things that the area provides that will also encourage people to get up, go out and to move a bit.
Councillor Snell.
Thank you. I think this question is probably to Warren because it looks at the strategic context rather than the particular details of the Kings Park project. I have done athletics coaching and raised money from various Sports England funds over the years that are desperate to get more people active in this part of London. And the things that worry me is, number one, I still don't think we have an overall sports strategy for Hackney, which talks about how each of these initiatives can then feed into onward development of whatever skills and aptitudes people show. Number two, I'm concerned that too many of these initiatives don't then tie through to the existing sporting networks that are there, the voluntary organisations that have often survived for quite some decades, and therefore give people a sustainable way to exercise more that doesn't rely on public funding. But then, quite honestly, the third thing I worry about is a lot of those organisations aren't really up to standard in terms of adopting minimum standards of child welfare. Best practice in developing children in particular was my area, and therefore is anything being done to monitor the organisations involved in this project to make sure that they do meet some sort of minimum safety and development standards? Sorry, a few questions there, but if we are to take this model and use it elsewhere, then I think these considerations are relevant.
So maybe Warren, and then I see Lola's hand up. So if Warren goes first.
Thanks, Councillor Snell. Yeah, I guess I'll come back to some of the questions. I guess one of the focuses in the Kings Park Moving Together project in Hackney is it's probably not at the sportier end of the organisations in terms of some of the groups you're talking about. What we're working with these groups who are trying to work with people who are currently inactive. So yeah, there's probably not been huge amounts of engagement with kind of some of those sporting providers, but I think in terms of making sure that the local safeguarding standards and that those organisations kind of have the right capacity, that absolutely has been a focus. And I know that Lola talked about the 15 to 20 organisations that that have been a part of Kings Park Moving Together. They absolutely would have to meet a set of criteria around their safeguarding policies, their organisational capacity. That's not to say that, I think as Lola's indicated, that there's not more that we could do to support those organisations, and that is a focus for the future funding plans through Kings Park Moving Together, is to support those organisations to get people active, but at the same time to build their capacity to be more sustainable, and yeah, to embed good practice in delivering physical activity to those individuals. So I don't know if that quite covers all of your questions, but maybe if Lola comes in, and then if there's anything else, Councillor Snell, I'm happy to pick up after that.
Thank you, Warren. And I just wanted to also provide that assurance, Councillor Snell, that we do make sure that we collect all of the relevant details and information and sort of supporting documentation in relation to any of the organisations that we grant fund. And we try to have more of a relationship rather than the kind of very transactional, this is your grant, and then we just see you when you send in your monitoring return. So we do either visit the organisations, we are able to, we're in a place, so we're able to connect with them in that way. And also we are working with a number of national governing bodies who are also connected into the area. But this network of organisations that we're now looking to bring together is about enabling those organisations to also encourage and enable each other, so to learn from each other around what good practice looks like, but also to think about the future sustainability around actually how collaboration and working kind of in that way will provide some sort of a stronger group of organisations for the future. But definitely all of the work that we do in the governing bodies and the organisations is important to make sure that we are safeguarding everyone who's involved.
Warren, did you want to come back again?
Yeah, sorry, I missed the first bit about the sport, the first question about the sports strategy. And I guess some of the pilot areas that we work in do have a sport and physical activity strategy for their place, and some don't. I think what we are supportive of is that sport and physical activity is embedded within policies and strategies. Whether that has to be a standalone sport and physical activity strategy, though, I don't think it's about being directive about that. The health and wellbeing strategy that you're currently developing, and I'm sure has been looked at through the Commission, I'm really encouraged that physical activity is within that policy. I know some other places it's very heavily embedded within adult social care strategy, or their low carbon kind of policies around active travel, etc. So I guess this comes back to the point of, I don't think there is necessarily a one size fits all approach for every place. What's important to us is that sport and physical activity is embedded in strategies, whether that's a standalone or whether that's across multiple existing strategies is obviously a local decision.
And Warren, is the case that you're sort of providing iterative feedback and ideas to sort of Lola as you go along? So you see something happening in Essex which is working great, you think, hang on a minute, let's tell that sort of the other areas about this as a way to sort of like perhaps they could try that. Is it that sort of relationship that you have? And I suppose my other question is, how are you monitoring this at the end? How are you monitoring the impacts? If you just say a little bit about that.
Sure. So on the first question, yes, absolutely. I don't think that's necessarily just Sport England saying, "Oh, I've heard about this in Essex." So all of the pilots have a great deal of connectivity with each other. That's sometimes on a one-to-one basis. I know Lola has conversations with colleagues in Southall and colleagues in Essex, actually, as well as others. But all of the pilots actually meet together on a regular monthly basis that is kind of facilitated by Sport England, but is not that. But yes, also if I'm having a conversation with Lola, there are occasions where I say, "Oh, I think I heard that Calderdale did something on that last week. You should definitely have a chat with them." So I can't promise I know everything about what all 12 are doing at any one point in time. But yeah, absolutely, there is that connection across. And just building on that, what's going to be increasingly important over this, we're just about halfway, I guess, through the pilots, is that it's not just about the 12 sharing with themselves, but increasingly now that they're all well into the 8-year funding period, I guess, that it's about how do we share that learning wider. We've done some of that. There's a link to documents, I think, in the papers that were provided, but I think we've got much more to do within the pilots, but within Sport England to support and facilitate that. So that's in terms of the kind of the learning sharing between and outside of the pilots. The second part of the question was around monitoring and impact, and is the $64,000 question, I guess. We set out to do something differently because we felt that it had it had a greater chance of making that long-term impact. We do use some, I guess, traditional measures in that. So we run Sport England have the Active Life Survey, which is published twice a year currently for adults and once a year for children. And we do look at how the pilots are compared to national averages and also kind of comparator organisations. The early indicators are, and with heavy caveats that I'm not a statistician, the early indicators are that there is some evidence that the pilots are, I won't go into the detail, but if you like, performing slightly better than the the many non-pilot areas. But there's much more to what we also know is whether there's a direct correlation between the work of the pilots or whether that's a statistical and we don't know that yet, because what we do know is these are long-term programs that some of the work that we're doing now to embed physical activity in strategies, in policies, in structures may not reach fruition for a number of years. It may not even be another 2 years. It may be in the long term. So I think that's a long way of saying, and as well as the traditional monitoring, the hard numbers, there's a much stronger focus than we've ever had before on the learning. And what are we learning, both in terms of what's working well, but also, what isn't working? Why isn't it working? Well, okay, let's, that hasn't worked. Let's try something different. So there's a huge focus on the kind of the learning elements, and that will be an increasing focus over the kind of the duration of the pilot. So it is a question we're asked regularly by our board members around that kind of the impact. There's good data, there's case studies, there's good narratives, there's good stories, there's lots of policies we could point you into where physical activities become embedded. But I think it's an ongoing question and an ongoing area that we are looking at, the pilots are looking at in their local places, and one that we'll keep revisiting.
And just building on from that, Lola, do you see part of your role as or is it part of your role, to sort of things that are, say, working well as a result of this project, and thinking, hang on a minute, without too much resource or perhaps no resource, this could be replicated elsewhere in Hackney, and then spreading that learning and knowledge? And are there examples that you've done that, or that is a train that's in train?
Sure, thank you. And yes, it absolutely is part of my role to do that. And I would say it's the things that are working well, but it's also the things that I would suggest we don't do. Because there is also learning in some of the things that haven't worked. And so, I think that is really important to bring. It is part of the journey. So it's definitely the things that we share. And if I could give a couple of examples of how we're now trying to take learning from Kings Park and to take that to more of a borough level. Walking is one of those, and just thinking about the way that we think about walking, potential for walking interventions, because we've got a lot of evidence about group walking, reasons people walk, about the whole range of things that Jeanna has already shared, but also we worked with a number of other providers that have done walking programs, Badoo Sports, Active Within, and just kind of built up a good body of evidence. Also, we have been working with colleagues in public health to look at how we take some of the learning around a place-based approach in Kings Park and think about some other areas within the borough, because I would say that place has been a very powerful context for this work, because of what we know about Kings Park, but also there's almost something about wanting to look at other areas and learn a bit more about what may work, so that actually there is a kind of longer term recognition of the learning and how that could influence the way that not only we do kind of delivery, but also some of the strategic policy areas of focus that we take going forward.
Thank you. Unless there are any other further questions. What I'm going to do, I'm drawing this to a close. I mean, that's fascinating. We've been wanting this update, and we're very glad we've got it. And thank you. It's fascinating to hear the work that's been going on. I mean, it may well be, as Warren says, we're sort of halfway through. I mean, it may be that we sort of ask you to come back again at another point. I think maybe as a sort of like challenge to ourselves and to you, in sort of as a council, to see, well, what else within the council have we learnt from this, and that we're actually taking forward, possibly in other areas, and possibly exploring that a bit more. So thank you very much, everyone. Jeanna, thanks for telling us about about the working group, and it's great to hear about the work, and I think it's something we'll want to come back to. So thank you very much. So I'll draw that item to a close. I'm next going to move on to item number 5 in the agenda, which is it's been sort of badged as challenges in primary care post the pandemic, but I think we wanted to use it as an opportunity for the Richmond Rd Practice, who've won a number of awards, to come and speak about the work that they've been doing, and I've certainly heard about it from numerous sources, and to also just understand what as well as the good work they've been doing, and just understand what some of the issues that they currently think at the top of primary care practice. But we're also joined and grateful for Healthwatch for 2 bespoke reports looking at GP practices websites in Hackney, and some areas where they can improve, and also about access. Just before I sort of introduce everybody, it should also just be noted that at our next meeting, we're going to be taking a sort of broader view with the Confed and possibly the CCG as well, and taking more of a sort of a 5-year forward look at what GP practice in Hackney are going to look like over the next 5 years. This item being more of a deep dive into Richmond Rd and those 2 Healthwatch reports. So to start with, can I ask Dr Gopal Mehta from Richmond Rd, and we're also joined by Dr Suresh Tirawal as well from the Richmond Rd Practice, to maybe speak to their reports and tell us a bit about what you've been doing, and also what do you think are the main challenges facing you right now. So Dr Mehta, over to you.
Thank you so much, and thank you for having us this evening. Let me just get my slides up for you. Can you see the slides clearly?
We can. Yeah.
Okay, great. So thank you once again for having us here today. I'm Dr Mehta, Gopal Mehta, one of the GP partners at Richmond Rd Medical Centre. Sorry, just a moment. Can you still see those slides?
We've got a blue screen. We have actually got paper copies of your slide pack you sent through before as well.
Okay, just a second. Sorry, there's.
We have that as well.
Okay, right. So you can see this?
Yeah, presenting.
Sorry. Okay, grand. Okay, fantastic. So thank you once again for having us here today. We've come to talk to you about some of the things that we've been doing at Richmond Rd. Oh, sorry, just a second. For those of you who don't know us, Richmond Rd is a practice based in the southwest of Hackney, serving approximately 15,000 patients. We have a very dynamic and diverse population group, and it's a practice that is growing relatively quickly. We also operate 2 other practices, a Sandringham practice and Aldersbrook Medical Centre, which is actually based in the London Borough of Redbridge. Sandringham is in Hackney. So we've come today to talk to you about some of the initiatives that we've put together at Richmond Rd. I think the first one to start with is around our access system. So as an organisation, we firmly believe that actually you've got to get access right and ensure your patients can get appointments before you can do lots of the exciting, innovative pieces in surgery. And what you can see on the screen today is our sort of results from the GP patient survey, which was just very recently launched. We attribute a lot of this feedback to our patient first model of access, which ensures that all patients that contact the surgery are guaranteed an appointment within 24 hours of making contact. Patients can pre-book telephone calls at times that are convenient to them, so they're not waiting around all day for a GP callback. Patients can also book direct face-to-face appointments. Our access system also incorporates a priority patient scheme whereby patients, a certain cohort, young children, those with mental health issues or pregnant women, for example, are guaranteed a same-day appointment regardless of the time that they call. And we also embed a duty doctor scheme, which is spread throughout the whole of Hackney, whereby any patient that calls us with an urgent medical problem will get a call back from the GP within 2 hours of that call. All our receptionists are otherwise known as skilled reception navigators, who ensure that when you do call the practice, you are speaking to the person that is most suited to your needs, and that ensures the patient journey is as effective and efficient as possible. We have a huge suite of health initiatives that we share with our patients across the entirety of our organisation, empowering our patients to really improve their health from within their own homes. Examples include our antenatal and postnatal classes. These give pregnant patients and their partners access to an 8-week course with a GP and an NCT instructor to prepare them for their pregnancy journey. We have a Best Start scheme whereby as soon as a child is born, they're registered onto this scheme where they get a named GP and a named administrator who collectively manage a child's development, immunisation, social and well-being journey right from the very onset. So that's around addressing the wider determinants from the get-go. We have quarterly campaigns at the surgery where we send out surveys to our patients and we ask them, what is it that you want us to explain or do some more teaching on? We've just finished 8 solid weeks on all things dietetics and gut health with a very experienced and senior dietitian, and we are now looking forward to launching a women's health programme in April. We offer monthly first aid to our patients to join online, and they can also come to the practice to do first aid classes. And last but not least is our wellbeing programme. So like patients can book in with a GP or a nurse on a weekly basis, they can also, with a click of a finger, book into a selection of classes online. We offer weekly Tai Chi, weekly yoga, weekly mindfulness, weekly breath work. We're currently this week doing a big wellness retreat, actually, where every day there are a number of classes that patients can join. We then look at the feedback from the retreat, and then we start making these classes more regular if they've been particularly successful. A recent survey of our wellbeing programme evidenced that 98% of patients felt less stressed and reported an improvement in their wellbeing. And a survey of antenatal classes found that 99% of women felt more prepared for their birthing journey. So in addition to health promotion, we focus heavily on disease prevention and the management of long-term conditions. There is no doubt that this happens across City and Hackney, and it happens well across many practices. Our focus on this piece is really around doing things innovatively. And the reason for this is because we feel that bringing in innovation to the work that we do really helps to encourage uptake and engagement. Our examples of commitment to this are included our drive-through flu clinic, which meant that any vulnerable patients or patients that didn't want to be in the surgery earlier at the end of last year were able to just drive past the surgery, have their flu jab and go. And then we had our which became very famous, our Peppa Pig's flu campaign. I remember sitting on a PPG meeting with our patients and partners at the early part of September saying, what can we do to get our 2 to 3 year olds in the practice? And lo and behold, there was Peppa in our waiting room 3 weeks later. It was a hugely successful event. We vaccinated 55% of our eligible 2 to 3 year olds, the highest we've ever been able to do actually so far. Lots of parents said to us that actually they were only able to bring their child or convince their child to come because they knew Peppa was in town. And then we have all things health, again, health promotion around our Healthy Mind event, which is a very well-established event that unfortunately hasn't happened for the last 2 years because of all things COVID. But in 2019, this event was hosted by 62 exhibitors within our practice premises, around 4 marquees and the outdoor space, and attended by 650 patients, who got to see all the different health and wellbeing services that are available to them within City and Hackney. Our focus on disease prevention and the management of long-term conditions has meant that we are amongst the highest performers both locally and nationally across the majority of domains. Our next focus is around patient engagement. We really do try and keep our patients as connected as possible through a variety of different means. We've done a very significant social media drive over the past 2 years because we felt that that's how patients wanted to connect with us. We've got following on Facebook, Instagram and Twitter. Patients will message us, they'll keep connected with us, we'll do quizzes, we'll do live feeds, we'll do health blogs, and actually it's been a huge success for the practice. And I do firmly believe that it's meant that our patient group feel much more connected to us because we generally post something on a daily basis. We obviously do lots of awareness events at the surgery, and then we have a lot of involvement with our PPG. Our patient participation group has become really integral to the running of our surgery. We involve them in all the initiatives that we do at the practice, but we also involve them in a lot of innovation. And actually, if they've got good ideas, we will put them out in the practice and make the most of that. So we're very lucky to have a dedicated patient group. Our fifth focus is all around staff wellbeing. It's not just patients that we try to look after. We work very hard to look after our staff teams. On Wednesdays every week at the surgery, we have an hour off where each staff member gets to focus on something important to their wellbeing. It may be yoga, it may be reading a book, it may be going on the walking club. And we generally offer a lunch on a weekly basis as well. We have found as an organisation that actually committing to your staff and focusing on their well-being is very, very important for retention, particularly in these very challenging times post-COVID and during COVID, and also allows the continuity of service. Our sixth focus, and perhaps the most important slide of the day, is around becoming part of the community. I think it was about 3 to 4 years ago when the practice thought, okay, I think it's time to do something different. We've got our appointment system in order. Patients can get those appointments, but we really need to do something different that allows us to tackle the health inequalities and really and truly become part of our local community. So we looked at the 4 pillars of a population health system, and we noted that one of those pillars is around creating a sense of belonging and belonging to a community. So we thought, you know what, we have to do exactly that. We need to transform, and we feel we have transformed from a normal GP practice where you get to see a GP or a nurse to a centre where there is so much more going on. We have these awareness days over the whole of last year when the half-term holidays came and the children didn't get this free school lunches. We provided them lunches. We went over the winter to all of our elderly patients and gave them meal packs to support them over the winter period. Christmas time, we were going to do a big winter wonderland. We had reindeers, Santa, everything was planned again at the practice site. Unfortunately, that didn't happen due to COVID. So instead, we gave all of our presents to the local hospitals and hospices. We have worked exceptionally hard to reach out to those patients who may be socially vulnerable, isolated, or just alone. We have connected with local services such as the Hackney Volunteer Centre. We offer Thursday coffee catch-ups, and we offer exercise classes within our practice site. Just last Thursday, a patient who came to one of our coffee catch-ups came to me at the end and she said, Dr Mehta, can I just say I have not left my house in 5 months, and this is the first time I'm leaving because I knew there was coffee and I knew there was going to be some people here with whom I could connect. And I thought that was exceptionally powerful, and it really did evidence that, you know, you can do so much more in general practice than just straightforward consultations. You can really help people in very different ways, and it's something we're exceptionally proud of. We do believe that our feedback across all of our channels, be Care Opinion, Google, NHS Choices, has had a very, is attributed to a lot of the work that is going on at the surgery. Our staff teams are working exceptionally hard to offer the service that they do. We have been very proudly been at the GP Awards 5 years running. 2 of those years we've won Best GP Team England. We've also been won RCGP Award for outstanding contribution to the NHS. And 2 years ago we also had the parliamentary nominations for, again, our contribution to mental health and long-term conditions, again, which we're really proud of. So that's everything in terms of our initiatives. I'll just stop screen sharing for you now to take any questions.
Thanks, Dr Mehta. What I'm going to do is I'll open up the questions on Richmond Road, and then I will, after a short while, then sort of maybe ask Jon just to briefly go through the Healthwatch reports and deal with that as a second section, as it were. I suppose one question, you've taken, say, over other practices other than just Richmond Road. I mean, how easy has it been to take your model that you're so successful at Richmond Road and embed that in the other sites for them to emulate that everything you've been doing on Richmond Road? Presumably, what have you done? Have you had to move some key staff over who sort of have that culture embedded to try and start it off? Is that still a journey that's going on? Can you just tell us how easy that has been?
Yeah, of course. So we've now taken over 2 practices. First practice was our learning practice, when we understood exactly how it was to take over a new site. But I can confidently say the second practice that we took over in 2019, which was most definitely at risk of closure, we really went all in. Our management structure joined that practice. We are very visible. We are on the shop floor. We ensure that we lead really from the front. Our models around access, telephone appointments are all sort of pre-figured out. So we feel that as long as you can offer those appointments and offer that access, you can deliver that in other practices, provided you have the right workforce in place. So regular GPs, regular nurses, in-house phlebotomy. We have connected very early on with the patients. I think a few years ago, if you had asked us about patient involvement or PPGs, we would have thought, oh, that's that meeting that we do a couple of times a year to try and just tick a box. But, we firmly believe that, patient groups can hugely impact a practice takeover and support you in takeover of a new practice, because if you listen to them and understand from them what it is they want from a practice, you can develop it in that way. And we've in our Redbridge site, we've just planted some trees across the front of our garden to remember all those patients who have passed from COVID-19. You can't do that without ticking all the core boxes first, connecting with the patient group, and really trying to think out of the box. So yes, if you use the models appropriately that we've developed at the surgery, and I'm not going to say it's easy, it's hard work, particularly working with new staff and new patient groups, you can make it work.
And just obviously our mind is sort of thinking here, well, hang on a minute, the extent to which other practices can replicate the model that you are you now taking Sandringham as an example? Are you seeing the sort of the performance indicators, the metrics improving at say Sandringham practice since 2019?
Absolutely, there's no doubt about that at all. So if we always focus in order of like what's important, so access is key, but then we really have to look at health outcomes. So before you can start going on social media, you've got to make sure you're improving health and well-being for your patients. And we have evidence that at Sandringham practice, which was probably one of the lower performing practices across the borough, just hitting minimum, if minimum, in health outcomes. We hit maximum across every domain within 18 months of takeover of that surgery. Again, I was presenting recently and I talked about the fact that we went to the local churches. It's a very difficult population group to manage, very different from Richmond Road. I went to the Black African churches and I spoke to these patients and I talked to them about blood pressure and diabetes, because you have to change your focus depending on the population group that you're serving or that you're managing. But if you just think slightly out of the box and try and bring them in innovative ways, you can make difference.
Thank you. I mean, I could keep on asking questions, but I'll open it up. Members, Cllr Oguzkanli, I saw first.
Thank you, Chair. I mean, firstly, it sounds like you're doing an amazing job. Well done for all you're doing for the community. What I wanted to find out specifically is the financial resources that goes into the number of projects you've listed in your presentation. How are you funding those, and how challenging it is for you to get enough funding to channel to your projects that you've listed? Thank you.
Yes, so we fund everything from the partnership. So we don't get sponsorship or anything like that. Essentially, it's partners funding. So just like we would spend on GP cover or HCA cover, we would spend the same money on all of these initiatives. They're completely free for patients. And initially we thought, oh God, there's a lot of spending going on here. But we've seen the rewards now. We really feel that we've noticed that actually that investment into our patients has made significant outputs. An example would be our antenatal classes. I remember we had so many disappointed patients and pregnant women when their partners were unable to join their labour sessions and they had to go to hospitals alone. And we thought, we need to do something different for these patients. Let's put on this 8-week course. This may cost a patient £1,000 or £500 to £1,000 if they were going to get it done privately. Let's do it for all of them. Let's create a community of women who can connect with one another once they do these classes. And that's exactly what happened. They connected, they've kept in touch, they've had their babies and their babies go to classes together. But what we realized is we educated them on a whole. So it was like a group consult. So lots of the queries that they may have come to their GP, for example, they would speak to the NCT instructor or the GP that was doing the sessions with them. So in the long run, actually, it has worked. It's worked really well. And it's most definitely improved health and well-being for patients.
So just before I bring Councillor Snell in, let me just get this clear. You're getting for the yoga, for the antenatal, for Peppa Pig, you've had no additional funding?
Absolutely no funding. This is all practice partnership funding.
Okay, Councillor Snell.
Thank you. For historical reasons, I don't go to a surgery in my own PCN, but you're making me sound as if I ought to change away from the Lawson practice, good though it is. I just wanted to recap, because in fact I was one of the people who raised concerns about, was it the Sandringham practice and the one next door some years ago, because we were picking up complaints from residents and in fact Healthwatch looked into it. This is, sorry, off the main point, and I share the concerns of other members of this commission, that what we should be worrying about is spreading good practice to the minority of surgeries that don't follow it, and we're going to look at that next month, I hope, the next meeting. But on this one, just bring me up to date. So what's happened? Because Sandringham Practice is right next door to the Dalston Practice, and it always seems to me slightly crazy that we've got two identical surgeries right next door to each other. Is that continuing, or are there any plans to do further merger work that would sound to me as if it could offer a wider range of services in an amended building? Is that going anywhere, or is that held up at the moment?
So it's two separate contracts completely. The Sandringham Practice is on an APMS fixed term contract, which is another 5 years under sort of our care. The Dalston Practice is a partnership led contract. So there is a partner there, and that doesn't have a sort of fixed time to the end of it. I completely understand. I agree with your concerns. It's a purpose built building, and we would love to see it joint together and do more joint working with the practice. But in the way that the contracts are currently set up, they are two very separate organizations, and will remain that way, I think, for the foreseeable future.
And just before I come on to the Healthwatch, I mean, in terms of your access, which is obviously something that we frequently pick up in terms of casework, and increasingly in terms of sort of the digital divide. I mean, pre-pandemic surgeries, a number of surgeries sort of struggling to sort of catch up. I think it was with Doctors First, who were creaming off a number of patients from Hackney by offering the online service. Now we come forward to in a pandemic period where there's an awful lot online, and perhaps people who are on the wrong side of the digital divide are finding it harder in many surgeries to call up and to get an appointment. And some of the feedback we were getting is, look, the system is fine trying to get everyone in, get everyone seen within the day, and the telephone triage. But as soon as you're one member of staff down, there's not enough capacity in the system, and the whole thing falls down. I mean, how are you making it work where you are so accessible?
Yes, I think it's really important. I mean, we were quite fortunate as a practice. Patient First, which is a telephone first system, was actually pre-COVID. So our patients were quite used to the fact that that was the way that we would operate, and they would speak to a GP and then they would get appointments. But we do not keep it at that, and we do not, 92% of our patients are registered to use online services, but we have taken away all barriers to making an appointment. If a patient wants to come through the front door, if the patient calls, they can get appointments at times that are convenient to them. We have throughout the week directly bookable face-to-face appointments, because we understand, the teacher or that they may not be able to call at 8 o'clock in the morning to try and secure that telephone slot. And actually they just may want to see a doctor face to face. There might be certain cultures, certain population groups who actually need to be seen face to face, because however much you try to talk to them on the phone, you may just not get to the end of to the end of the story. So we have tried to adapt that and essentially obliterate all challenges to getting through the door. And what we do is every week or every month we have a surplus number of appointments. So we don't just work on, if we need 100 this week, let's just make sure we've got 100. COVID has taught us that you really need to plan for all eventualities, plan for the fact that a doctor might be off, plan for all of these changes. And that's where we've created our surplus provision, because if there is a doctor off for a reason which may or may not be COVID related, the practice offer remains the same. When our GPs go on annual leave, we cover everyone. So we don't just say, sorry, we've got 3 doctors down today, we're just going to have to do what we do. We plan well in advance to ensure that our cover remains the same week on week on week. And I think that consistency has meant that we've developed the model that we have.
Presumably you would say there's no reason why, say, every other practice in Hackney couldn't adopt to a similar sort of model if they wanted to.
I think the model can be used across City and Hackney, but I think it's been hard work. It's been a journey, and it takes a lot of energy. We do long hours. I pretty much feel like I live at the surgery sometimes. I'm not going to say to you, it's very relaxed and we don't have to do anything, but we all work exceptionally hard. And it's not just GPs. You can have the best access system in the world, but I firmly believe that our front line, our reception team, are really the soldiers here at Richmond Road. They go so over and above. They will navigate people into such an appropriate slot that may not be a GP, therefore saved another GP appointment for someone that needs it. And it really takes a whole team. It takes a whole team effort to really make a model like this work. Otherwise, it just won't.
Thank you, Dr Mehta. It's been fascinating listening. If you could just stay. Oh, I see Cllr Adams for a question. Councillor, can I just put your microphone on? Sorry, I should have. And then after.
Yeah, sorry about that. Just wondering that, I just want you to share with us the kind of barrier that you came across when you were setting up your model and how you managed to overcome it, before you become successful at the model.
Do you mean the access model?
Yes.
Yeah, so I think, again, we're talking pre-COVID. We had to try to explain to patients why suddenly we wanted to triage them over the phone or help support their patient journey, essentially. So we did a lot of comms around it, to be honest. It wasn't one day we were going to change the system tomorrow. I think we did a 3-month lead up to a change in our appointment system. We counselled with our PPG. We did lots of sort of demo days. We had patients in. We registered all of them with online access. We had to prove the benefits of the model change. If we had changed the model and it had fallen flat and people were still finding it impossible to get appointments and not getting through, that would not have worked. But when we said this model will ensure that when you contact us, you are guaranteed a GP appointment within 24 hours and probably much quicker than that if your problem is more urgent, the model spoke for itself. So lots of comms, lots of hard work at the time of launch, and lots of regular tweaking to the model, which included the reception team triage and navigating roles, which I feel like has made a significant improvement to how appointments are utilised.
Thank you, Dr. Mehta. Can I just move, keeping Dr. Mehta there, because I maybe appreciate his views on this, the Healthwatch reports. I don't know whether, are we joined by Jon Williams, who's the chief exec, and Malcolm, who's the, Alexander, who's the chair, and also Dr. Vinny Patel from the LMC. In terms of your 2 helpful reports flagging suggestions in terms of websites and in terms of access, which of you, could I just have a very brief introduction from one of you, please, for those 2 reports?
Okay, let me first of all say a couple of things about Dr. Mehta's presentation, which I think is congratulations on your awards, and it's a really sort of fantastic example of what can be achieved. And I think it's really important that your model is spread across Hackney. I think it's really important that we sort of think that a lot of primary care in Hackney is not working well. We've got to be very aware, for example, that Southgate Practice, Wiston Road is closing, with 6,000 patients having to find new surgeries, which is a really serious problem. We've got to be aware that we've lost 3 practices over the past few years. And also there are a number of practices at the moment that are not in a good condition, perhaps. They're going to need succession planning, and the resilience is a really important thing in making sure for the future that we have high quality primary care across the whole area. So I know that CCG and Richard Bull is very active in developing this work together with the NHS Confederation.
Malcolm, at the next meeting we're going to be doing more of a sort of overview. Your 2 reports, can you just very briefly introduce them so we can go into those?
Okay. So 2 reports. The first one I'm going to talk about is the website report, where you'll see very, very detailed work in which we looked into all of the GP practices across the borough. And we looked in things like, what information is provided about PPGs, about out and hours work, about interpreters, about registration, digital offerings, and so forth. And I think in many of those cases, the social prescribing was another one. In many of those cases, we were quite disappointed by the quite poor information on some of the websites. There were some very good ones, but some were very disappointing. I mean, particularly the information about patient participation groups was very, very poor and very out of date information. Information about extended consultation periods was also very poor. Now, the important thing is, and I think this comes from our collaboration with the CCG, which I think has been working very well. And what we're now seeing is there are significant improvements in those websites. I mean, also the issues about complaints were poorly dealt with. Many didn't have the complaints charter, which we agreed on the website, but that is now changing. So what we are seeing as a result of this work is a very significant change in those websites. Still, there's a long way to go, but it's very important that this interactive work is really achieving the ends that we are looking for. The other report is about registration. When we first did the registration report, which was in March 21. Really, we got very, very poor results. It was quite disgraceful, really, that, you know, particularly in terms of people who are homeless, people who are migrants, and other people who are vulnerable, the system was actually working very badly for many people. And in many practices, the information about the duty to register people was not really very well understood by the team. And that situation is now, I'm glad to say, improving. In October 21st, 21, we did a second report, and we saw very significant improvements. I'll say again, thank you to Richard Bull for the collaborative work we've done with the CCG. And I think because of that effective collaboration, it has really sort of brought about a significant change. And we're now seeing that this whole issue about ID and address, which was being demanded in some cases by practices, which wasn't required, is now changing. And I think every practice is fully aware. We even had one practice that said we don't register asylum seekers, which was quite extraordinary for a practice in Hackney to actually believe that to be the case. But you know, that situation is really changing. What we really need, I think, apart from good quality information, good information on the websites, is to make sure that the training of practice staff isn't just a one-off, but is continuous, because the full staff staff change. And we've got to make sure that this process carries on and on and on, because the last thing we want is for people to go out to the practice and not be registered. I mean, some practices didn't seem to have paper registration, and for people with no computer, of course, that's a very big problem. I'll stop now, but I think it's a very positive picture. We've got to make sure that those practices which are vulnerable at the moment are not lost to us. We can't afford to lose other practices. So next time, yes, let's have that debate, but I think it's really important that we've seen such significant progress. Thank you.
Thanks, Malcolm. I mean, but both those reports are very helpful to us and sort of flag key areas. Can I just bring, I see John Williams Q. Can I just bring Richard in at this stage? Richard Bull, who's a Programme Director for Primary Care for the North East London CCG. I mean, we can see there on the helpful slide or the presentation deck, say in terms of access, those practices that were asking for proof of ID and address, and that wasn't a statutory requirement, and that's reduced since Healthwatch's report, but there's still, I think, 7 or 8 that do. I mean, can you talk us through what levers you're able to pull, just to take that as an example, to shift those practices in terms of change of behaviour?
Yeah, thank you very much, Ben. And thank you, Malcolm, for your kind words. It's a pleasure to work with Healthwatch on this joint improvement programme on websites and on GP registration. And in fact, we've commissioned Healthwatch to go back in again and rerun their registration report, because it's hugely valuable. And we did that for the second report too. And I'm very pleased to see some improvements, but also it is still incredibly frustrating that practices aren't getting the message right all of the time. And practices themselves, as well as the local medical committee, also share that frustration. This is a very hard nut to crack, I think. There are lots of materials out there to support practices to get the message right, but this seems to be an ongoing, in some practices, not all practices, in some practices, an ongoing disconnect between management policy and direction and the front line. And I think it does reinforce the need to continually reinforce the message. What is the practice policy on registration? The practice is not there as Checkpoint Charlie asking for ID. They do not need to do that. They should not be asking that. It's a really quite clear message to get across the frontline staff. They should not be asking for that. But as I say, that's a very hard nut to crack. I contacted all of the practices in this most recent Healthwatch report, as I did in the first report, to actually talk through the Healthwatch findings. And again, it comes back to frustration. This is not the practice policy. This is not the practice way. Hand-wringing regret that actually that's what Healthwatch were told when they made these calls. So in terms of levers, we can start to issue breach notices. I'd rather continue to support practices to improve rather than going down pure contractual routes. With the GP Confederation, I'm going to put on additional training. I know there's support materials from the LMC. we can continue to encourage patients to register online if they indeed can, and they're not suffering from the digital divide, because I think it's less likely then that you're going to be asked to provide registration. And of course, we do have the greenhouse practice as well, which is there for all vulnerably housed and homeless patients. So there are contractual measures, but I think it's continuing to support practices to improve on this. And practices do want to improve because they feel just as frustrated as everybody else.
And is this something you can wrap into the Confed sort of like contract, or something that they're specifically using a carrot and stick approach, working with those specific practices over the next year? I mean, can you task the Confed to sort of this as being one of their metrics to seek improvement upon?
Not really, Ben. The buck stops with me. I manage the contracts on behalf of NHS England. It's not the GP Confederation. The GP Confederation manage enhanced service contracts with practices. The GP contract is between the CCG, NHS England, and individual practices. So really, I should be doing that, not the GP Confederation. So yeah,
but I suppose
I'm committed to do that.
But I suppose in terms of some of the work Laura does, in terms of whether you're sort of being a more sort of bit more of the stick that carrot, but say Laura or the Confed goes in to actually say, look, and actually provide a helping hand as to how it can be done. So in other words, to work in, you know what I mean, to provide the support function for some practices that might not have the capacity or the knowledge to make changes to their website, etc., etc.
Indeed, they can, and they're certainly going to put on some training around the requirements of GP registration. And I'm talking to my North East London colleagues as well about what else we can do to give practices the support they need by way of guidance, etc. Because sometimes there are, unusual circumstances where practices probably could do with a bit of extra guidance in terms of individual requirements. But the basic message is still quite clear. You do not need proof of ID and address to register with a GP practice. That really is quite basic and fundamental.
And Mr. Shah was just making a message in the chat there about the Minor Ailments Scheme. Do you just want to speak to that for a minute, Mr. Shah?
Yeah, sure. The Minor Ailments Scheme was sort of changed about a year ago, where only exempt or certain patients are able to access it. Together with that, unfortunately, the publicity for the Minor Ailments Scheme seems to have just disappeared. And from my point of view, as a pharmacist, there, the uptake is so much lower now than it ever was for the Minor Ailments Scheme. It still exists. There is also a new GP CPCS service that's available for GP practices to refer patients onto the pharmacist, who would then do the consultation and provide the medications for the patient. Those sort of initiatives would take a lot of pressure off GP practices, and pharmacists who are also sort of healthcare professionals on the front line. And just like the Richmond Rd Practice, our doors have never closed. And I also know that there are some practices out there who are very difficult to actually access. And we are there available for these sort of services. And the GP CPCS service is definitely something that should be sort of pushed a little bit more across the board. I know that the LPC is working with the local networks and trying to actually sort of get some more information out there about how the scheme may work. Some practices are using them, others aren't. It's something that can be addressed, I think.
Thank you, Mr. The sound quality wasn't brilliant, so I missed some of that. But what I might just get, I might get Giles just to touch base with you afterwards to make sure we got all of that, and then that can be sort of circulated. Circulated to around and to others. We're slightly over on this item now, and I am wanting to draw it to a close. I see Cllr Adams, and then I'm probably going to bring in John, who had his hand up, and I'm probably going to bring it to a close. Cllr Adams.
Sorry, Chair. This is just a personal experience. I'm just looking at the DeBeauvoir Surgery. They said that no proof of ID for registration. That's not true, because my surgery is closing down. Which is Wiston surgery and Southgate surgery. And so they said we should look for a new surgery. So we went there. I downloaded the form. They don't have online form. I downloaded and filled it for my whole family. I went there. When I got to the reception, they told me I need to go and bring my passport and proof of ID and everything. And they didn't take the form from me. So they sent me back. I had to go and register at Lawson Centre.
Councillor Adams, was this because on DeBeauvoir,
last week. It was last week.
Oh, last week. So is that, so I think that probably goes back to Richard Bull's point about Healthwatch perhaps needing to do another sort of mystery shopper exercise, as it were.
Last week I did it.
I
was so upset because I had to rush there and hoping that I need to just deliver the form. The form took a long time for me to fill. It was download it and everything. They don't have online form where you can fill the form. So getting there saying that, oh, sorry, we can't register, you go back.
I think that goes back to the point about Healthwatch needing to do another. Councillor Oguzkanli?
On the same subject, Chair, can I just make a suggestion? In my view, it's totally unacceptable for GP practices to demand proof of ID and address when there's clear guidance from NHS, and it is well known that they have to admit patients, and I think it is quite disturbing, to say the least, to find out GP practices are still refusing to register patients and refusing to treat them. Would it be possible for us to write to those, I think I've counted about 7 practices as the Commission, and ask them if they still continue with that practice and on what basis they are refusing to admit and register new patients who are unable, for whatever reason, to produce form of identification and address?
I'm just thinking, I'm certainly happy to write. I'm just wondering whether it would be the position of us writing to individual GP practices, or whether we should be writing to Richard in terms of, because otherwise we're becoming quite involved on individual practice levels. But
I just feel like a formal request needs to be made.
I agree. I agree. This is right for some action. Councillor Snell.
There must be a structural reason why people are choosing to do something which is clearly bad practice. And I don't think we've been told that at tonight's meeting or in the papers presented. Is it something they do to ensure that they can get paid for the patients that they take on? What we need to do is find out the structural reason people aren't doing this, and then do something to remove it, it would seem to me. Oh, that's a comment. We can pick this up next meeting.
Well, I think let's take. I certainly agree that it's important for us to note this, whether it's us writing into the individual practices or whether it's via the CCG. I think we just need to give a bit of thought to in terms of us entering into a direct relationship with the practice.
Sorry, Chair, when I got there, I actually show my council's ID card, as a proof that I'm a councillor. So she said no, it's not sufficient. So she sent me back.
Let's take it offline and let's come whatever we're all happy with, whether it's that or whether it's been doing a mini report on it on the back of the Healthwatch thing that we can then take forward. There's a way we can take it forward. I think with that then we're running over. I did say I'll come back to Jon. So Jon, do you just want to finish off with a few observations, and then I'll wrap this item up.
Just very briefly then and quickly, we do a report, a community insight database report on the services in Hackney, and one of those is on GP services. Our findings from last year was about 900 people. And it kind of covers things like appointment booking, waiting times, clinical treatment, staff attitude, and administration communications. Overall, the feeling is kind of quite balanced, 49% positive, 48% negative. But throughout all those areas, Richmond Road is noted as having a high volume of positive comments. That's across the board. So yeah, from our data, we're picking up a very positive picture from Richmond Road. Thank you.
Dr Mehta, your enthusiasm is infectious, and we're very grateful for listening to you. Just out of interest, just on that, you may be able to assist us. Is there any payment motivation as to why surgeries would be asking for address or ID, or would you put that possibly down to more training of staff? Can you shed any light on it?
Absolutely don't think this is a payment. There's no payment issues around this. I think this is down to training. And like you say, staff teams are changing quite quickly because of COVID and retention. You know, it needs to be rectified. I'm sure Richard is working on that, but I don't believe there's any hidden agenda behind it. I think it just goes down to training.
Thank you. Well, it's certainly something I sort of get the steer from the committee, but it's certainly something we should take action on, and that's something we can proceed with. So thank you very much. That was a fascinating report. Dr Mehta, thanks for all the interesting work and great work you're doing at Richmond Road, and it sort of lays the foundations for an item at the next meeting in terms of a sort of a broader view in terms of what the next 5 years looks like for GP practices in Hackney. With that then, I'm going to close that item and then move on to item number 6 on the agenda, which is the transformation programme with adult social care. And we're joined by the Group Director, Helen Woodland. Helen, thanks for your presentations in the pack. Can I ask you to sort of give a 5-minute overview, and then we'll open it for questions. Thank you.
Yeah, thank you, Chair. So I'm actually joined by Leanne Crook, who's my Head of Transformation, and by Georgina Deba, who is our new Assistant Director for Safeguarding Transformation and Workforce Development. This is only week 5 for Georgina, just to set the context. So I'm actually going to ask Leanne to give it an overview, and then we're happy to take questions, Chair.
Thank you, Helen. I brought some slides up on the screen just to run through, but I'll be quick in the context of time. So as Helen mentioned, I'm going to give a short briefing about our new adult social care transformation programme, recognising it's a big programme, and we're going to cover some headlines for you today to leave plenty of time for questions and comments. So in terms of the challenges that we're facing in Hackney at the moment, demand for and acuity of care is increasing significantly, and that's above the increase in growth in all age population significantly. So we know around 18% of people currently receiving home care from us were not actually receiving any services from the London Borough of Hackney this time last year, which shows just how significant a change we're seeing in quite a short amount of time. Unsurprisingly, linked to that then is the cost of care are rising, and combine that with the increasing demand, we're seeing this year-on-year growth of spend above what's available for funding for adult social care. Recruitment and retention of talent in the care sector, as we know, is a national issue, and it is also an issue locally here in Hackney. So amongst our sort of frontline operational teams, we have a number of vacancies and some use of agency workers, which we would like to reduce to improve the sort of consistency and quality of care. And we know this is even harder in our Housing with Care service, where the staff are predominantly care workers. And then lastly, but not least, is that we are continuing to recover from the cyber attack we faced. I think it's fair to say that the recovery of the adult social care case management system has proven to be one of the most complex areas of recovery. So at present, it's worth noting that staff are still using interim incomplete systems whilst we continue to rebuild and recover from the attack. So apologies, this slide will look slightly different than the one you have in your pack, and that reflects the fact that this is very much a live and new programme changing day on day. But what this shows is the vision we want to achieve in Hackney, and we've been co-producing this with our leadership team. And the reason why it's still very much a draft is that we want to engage with residents on this. But what we're ultimately wanting to get to, despite the challenges we face, is that all of our residents can achieve what matters to them in partnership with their communities, and where they may need support, that we can do that together and keep them safe, well and independent. Underpinning that, there's the principles on the left around being easy to access, personal to you and your strengths, good quality and safe and preventative. And that has to underpin everything we do, not just in transformation, but across the department. We've also been co-producing what we want our behaviours to be as a staff group with our staff, to make sure that we are behaving in the way and acting with integrity to make sure we can deliver on this ambition. So to deliver that vision for adult social care in a way that is financially sustainable, we need to transform how we are delivering our care and support. So we had a transformation programme in place for many years. Following the COVID-19 pandemic and the cyber attack, we've obviously had to redeploy and reprioritize, but in the summer we took stock and looked at how the challenges facing us and our communities have changed, and therefore reflected how we need to change our approach to make sure we can continue to meet those needs and transform effectively. So following that, we launched our new transformation programme back in autumn, and it's now underway in varying levels of progress. So this is largely the high-level priorities. We organise transformation under these 4 work streams. So the process work stream is ultimately looking at the customer journey. So what is somebody's experience from the moment they may think they need to access adult social care all the way through, and how can we implement processes that make that better? We have work stream around organisational design and development, and that's all around how can we attract a diverse range of talent to Hackney, and more importantly, how can we keep hold of that talent and make sure that they grow and develop with us and see a clear career pathway here in Hackney. An obvious one, given the recovery from the cyber attack, is around digital tools, and our priority at the moment absolutely has to be around restoring a safe case management system that really facilitates the kind of practice we want to see across social care. And largely, a really broad area, but a really important one, is actually workplace culture, and thinking about how we can embed a positive culture and promote compassionate leadership across the department, which we really think will drive up quality of the work, but also staff wellbeing. We know that hybrid working has faced many challenges, and we really want to galvanise staff under a shared purpose again. So how we deliver transformation looks broadly like this. Underneath each of those work streams I mentioned, there are a number of live projects and even more future projects down the line. So I won't go into detail, but just at a high level, in the process work stream, where we're focusing our efforts first is around what we're saying a preventative front door. So how can we do more to improve the experience of adult social care for people, right from the moment where their loved one or a health professional thinks they may need some support up until the point when they're assessed for eligibility. That's where we're focusing first and looking at optimising that the best we can before moving on to other parts of the journey. We are planning to do some recruitment and improving how we do that. We're also looking at relaunching a skills academy for our care staff and making sure there are clear career pathways in place for staff to grow and develop. And we're hoping to launch that in a couple of months. In terms of the projects live for digital, we are improving continually the safety and efficiency of our interim tools we're using, whilst planning for longer term recovery of our case management system. In terms of the culture work stream, we've been co-designing that draft department vision you've seen, but also looking at those behaviours and principles. We've then been working really closely with staff to understand what opportunities and challenges they have to work in that way, and how can we support them to overcome them. And whilst not a distinct project of itself, cross-cutting the whole programme is how we embed multidisciplinary working with our colleagues in the health and community voluntary sector as part of our neighbourhoods ambitions. So when we think about processes, it's how can we do that to facilitate better linkages and cross-working with our colleagues. Culture, how can we embed that way of thinking? It's across all that we do. So whilst we're not calling it a distinct project, we want it to be clear that it's a priority throughout the programme. And I think it's really important to say, it's obvious, but the whole point of transformation has to be delivering better outcomes and experiences for residents, and we can't do that unless we work in partnership with them. So what we try to do in terms of resident engagement, and what we want to continue to do, is have an ongoing dialogue with people who access social care services. So one example here is around the process work stream. So we spoke to a number of residents about their experience when they first came to us in adult social care. And it was important, these are people who had come to the service relatively recently, and we've also been learning from what we've heard from complaints. We then sort of worked with residents to design changes to the process, and then also tested out the solutions we developed with them again to make sure they were working. We changed our website to make it simpler to request support, and then got feedback from residents on that as well. So that's one example of how we want to embed it across the entire programme on an ongoing and iterative basis. In addition, we make sure we take the learning from our ongoing engagement boards that are run across the departments, such as the Carers Partnership Board, and we make sure the intelligence and insights from these groups feed into what we're working on and what our priorities need to be. So just a brief nod to how we know it's working. We are in the process of shaping a logic model to really make sure we are focusing on outcomes and not just outputs, and that we can measure the impact in the short, medium and long term of this work. There's often a lot of activity that happens and it can be quite hard to track outcomes. So we hope this activity will show the logic of the work that we're doing and what we hope it will lead to, and make sure that we can measure that to ensure we're putting our time and efforts in the places where we have the most impact. So that was a very quick whistle-stop tour through what we're doing in transformation. It's a big agenda, so I'm happy for myself, Helen or Georgina to answer any questions or comments.
Thanks, Leigh. Out of interest, do you sort of have it may be on a case-by-case basis, do you have a spend to save pot to throw at some of these on the idea to transform certain of these areas, or are you having to make sort of a case-for-case sort of financial bid as and when to say, well, look, if we set up an academy, it will cost X, but it will help staff retention down the line? How's that working, or do you already have a pot of money dedicated for transformation?
Should I pick that up, Leanne? So a lot of what we're doing is actually using the resource that we've got in a different way. So we have, for example, always had a learning and development offer. It hasn't been as coherent or as ambitious as we want it to be. So what we're doing is looking at the resource we have always invested in learning and development and working out how we can use that better. There are some things that require investment. So we have finance colleagues that are very closely involved in the transformation programme. And I think there's a distinction between things that we can do locally within the department with the funding that we've got differently, and things that are that kind of invest to save. So, for example, if we were looking at the use of assisted technology and how that fits and what we could do differently and better for our residents with that, that would be a business case where we would talk to the wider council, because we also wouldn't want to do it separately of our colleagues, for example, in children's services, where we might have shared priorities in how we do that.
Thanks, Helen. Councillor Snell?
The minutes attached with this agenda record my thanks to Helen for the briefing she gave me about the work we were doing to ensure we didn't lose lose hardly any social care workers as a result of mandatory COVID tests. So thank you, Helen, that was very helpful. At that meeting, you also, I think, referenced a concern that the biggest problem with career pathways in social care was the fact that for the NHS there is a national pathway, and so everybody understands where they are on that pathway, how their careers can develop, what their next steps should be, and that doesn't exist on a national basis for social care. So I'm very interested in the work you're doing, because this shouldn't be duplicated. You know, we're all facing the same challenges, we all have the same needs across the whole country. So in terms of the model that you are developing here in Hackney, how widely is that partnered? Are we in a position that that should then become good practice for promulgation and perhaps eventually lead to a national pathway?
So I think it's a really interesting question, Councillor Snell. So to be clear, things like a social work degree obviously is a national qualification. What there isn't, I would say, is the same terms and conditions for frontline care workers, and there isn't the same necessarily opportunities to access genuine kind of career development pathways. So if you're a care worker, there's a big step from being a frontline care worker to then becoming a kind of team leader or a registered manager. And how do we get staff there? But also, how do we stop the slight tension we've got whereby some of our staff will migrate into the NHS for better terms and conditions and job opportunities? And actually the NHS has problems recruiting and retaining staff as well. I think what we've also been looking at, which is really important, and this is where I think we probably can develop something that would be a model of national good practice, is using our neighbourhoods model and our integration to look at genuine pathways where we can support people to work across NHS and social care, and offer more opportunities really where staff can be upskilled. Because that benefits both of us. It benefits all of us, and most importantly, it benefits the people that we serve. So that's one of the things that we are doing, working with the Workforce Development Group as part of the ICS, which I think Laura Sharp is the SRO on. And one of the things that I think we're really keen as a system to develop, both so that we can support residents of Hackney to access better job opportunities, because we're keen to recruit locally and provide opportunities certainly for our young people and attract them into care and health, but also so that we can make the most of the amazing talent we've got in Hackney and recruit and retain it.
Thanks, Helen. Members, I mean, one thing, I mean, in terms of sort of partly in terms of staff retention, but also in terms of culture, I mean, presumably there's a significant embedded structural problem that we don't employ all of these individuals, and they're across a number of different providers, and there are presumably, yes, there are certain things we can do, but there are also certain significant limitations because of that. So it's just about being realistic about how far we can only go so far in this space, presumably.
Yeah, absolutely. And I think that's where kind of national schemes come into play, and wider job opportunities, and also obviously terms and conditions. So, you know, obviously we are signed up to the Unison Ethical Care Charter. We work very closely with our care providers. They are a large workforce in Hackney. So I think when we looked at vaccination rates, we were talking probably about 8,000 to 10,000 people. So that's a significant part of our economy that really does need some attention and investment. And I think this is back to our role as an enabler as a council, and how we can work with our providers to say, well, what job opportunities, what training are you offering? Can we support you, for example, to be more of an enabling function? So our occupational therapists are working with our home care providers to upskill and train and upskill their staff, so that rather than just being able to deliver care, I say just, not in a pejorative way, obviously, but also they're able to offer some re-ablement services to our providers, to our residents as well.
Thanks. I can see I've got a few hands up. But I mean, just for example, just feeding on the sort of the Richmond Road example from Dr Mehta there about, you know, staff having an hour of well-being and sort of a group lunch. I mean, to what extent can we start thinking about, say, writing into contracts of, say, I think we're re-tendering, I think, say, for 3 or 4 big providers for one of the contracts, that, you know, that there is an expectation that either that they're paid for for an hour a week. I mean, have we got the money to afford for that level of for that level of thinking, to actually pay them to have some sort of time for themselves, to let them know they're valued, to write into the contract that every 6 months you try and get everyone at the town hall to have a training session? To those, can we enter that space?
I think it depends what it is. So we have to bear in mind these are individual firms, some of which are voluntary sector, some of which are profit making. Some make more profit than others and have a greater cushion. Some have very large workforces, some have very small. So it's a very diverse market. I think we can absolutely look at embedding principles of well-being for staff into contracts, but I think we have to trust our providers to a certain degree in how they deliver those kind of principles of well-being.
Okay, so I saw Jon first, then I'll bring Leanne in.
Thanks for the report. That's really interesting and really helpful to understand what you're doing at the moment and how you plan to transform things, but also seeing your challenges as well. couple of points in the questions. Firstly, we're talking to some of your colleagues at the moment about resident engagement, and we're hoping that in our business case we'll be having a good programme to support you in what you're doing, because I think we're very aligned at the kind of want to making sure that you hear from the right people about those services. You mentioned the ICS, which I thought was really useful that you're heavily involved in that. I just want to understand better about how you're actually making sure the ICS fully understands the issues that you are facing, but also the way you're tackling those, because I think that's really important to make sure we're operating as an integrated system. And we're also kind of talking to Mark Foster, who's leading on your listening exercise around advocacy. I just want to have your reflection on about how you see advocacy fitting in supporting residents. Thanks.
So I think, John, I think we've heard a couple of presentations at Scrutiny around ICS and development, and the kind of theme that keeps coming up is that it's developing, and I think we have to go back to the point that it is developing. But I think it's part of our responsibility as members of that system to influence that development. And I think we're incredibly fortunate in Hackney that we've got really good, strong partnerships and a willingness to have those conversations. So I think we can say those conversations are taking place. And as part of the development of the ICS, I think we're all learning more about each other's challenges and our strengths. And that's really helpful in terms of identifying synergies where we might have problems that we can solve better together. But I think it's definitely a journey. And bearing in mind we've put back the implementation of the ICS until July, or government have, we're at the very start of that journey. But we are absolutely committed to making that work and delivering a better system for everyone in Hackney.
And I just, I mean, I think there has to only be benefit from the fact that the new head of the ICS comes from a local authority background. I mean, that has to provide an awful lot of, as much as it can do, assurance that there's some inbuilt knowledge there going forward. Leanne.
Yeah, I just wanted to come in on a few of the points there. I think your point about the culture and how we can do that with our providers, you're right, that is a very different challenge. But I think there are creative ways we've been trying to do that outside of things like providing lunches, which is less feasible. So things like having and hosting more forums for our providers, which has been really handy to do virtually in the pandemic, to share best practice between different companies has been really beneficial. We've also made sure that we've implemented routes for home care staff in particular to refer into our neighbourhood multidisciplinary meetings, which never used to happen. So they can be in the room with primary care, with social care, as an equal partner at that table to discuss the cases that they know really well. And that's really helped, not at an ICS level, but at a neighbourhood level, that shared understanding of what the different disciplines do. We've seen that be really beneficial. We want to keep doing that. And also, yeah, thank you, John, for your offer of support with resident engagement. You know, we would always take you up on that. That would be brilliant.
Thank you. Any further questions from members before I bring this item to a close? Then I'm going to, because we've got 15 minutes left for the COVID update. Thanks, Helen and Leanne, for that update. That's very useful to understand what you're working on, as John said. And so, yeah, it may well be that we revisit it in due course with sort of, when you're a bit further along, with perhaps some specific examples of how it's been embedded and what you've managed to achieve through it. Thank you. So with that then, I'll close that item, and then can I go to the last item on the agenda, which is Chris. Sorry, Chris, we always leave you to the end for the COVID update. Chris, thank you.
Thank you, Chair, and apologies from Sandra Husbands, who is unable to attend today. As you probably know by now, I'm Chris Lovett, Deputy Director of Public Health for City and Hackney. There was a written update circulated, and I'll just do a very brief summary, if I may, and then very happy to answer questions. I'm very mindful that today at around lunchtime, the Prime Minister did make an announcement of an intention to change potentially our response to COVID early. That at the moment we have literally no more details than what he said in parliamentary questions. It is likely, I think, that there's going to be quite a lot of information provided when recess for Parliament ends on the 22nd of February. So if I may try and avoid questions on that, because I think it was an unexpected announcement and there really is no more detail that we have. But just in terms of the cases for Hackney, we have seen a plateauing of COVID cases. They are still very high. In the last period of reporting, 1,822 COVID cases in Hackney. A little bit of a change about the age breakdown. So fortunately, we don't have significant increases in older people. But in the terms of school-age children, we have had an increase in the number of outbreaks in schools. And whilst most of the age-specific rates are going down, in school-age children, they are not going down as fast, and there is some evidence that they're going up. And that's not just for Hackney, that is across a lot of the London boroughs as well. We do have a lower incidence of COVID in Hackney compared to London and England. We're very fortunate that we've got significantly lower case numbers at the moment. We have had the number of people testing has gone down, so there may be some issue around actually people not coming forward for testing, and some of the national announcements around ending requirements for self-isolation at some point soon may have an impact on that, or continued impact on that downward trend. Hospitalizations, a small downward trend. There was a big fall towards the beginning of the year, but that now is only a slow downward trend, and they are still actually quite high in terms of people in hospital with COVID. And then in terms of vaccinations, Hackney still has low rates of vaccination uptake. Our colleagues in the NHS and the local authority are working still very hard to increase the number of vaccinations. And if you just pause for a moment to think, in the week ending 29th of January, there was over 3,500 Hackney residents vaccinated. That's still a huge achievement, but the rate of vaccination does go down, has been going down a little bit. In the last week since that 29th of January, actually we seem to have quite a large increase in the number of boosters, and that programme of engagement with communities and pop-ups and giving people confidence to get vaccinated is continuing. I think the message is getting out there that even if you had Omicron quite recently, that is not going to provide you with sufficient vaccination, with sufficient protection against serious infection, and you are much better to complete your vaccination course. So you do need to wait 28 days since a COVID infection, but then you really should restart your vaccination program, because vaccination is still one of the best protections against serious infection from COVID. So I'll pause there, and then, as I said, happy to answer questions.
Councillor Oguzkanli.
Thank you, Chair. My question is on the vaccination rate, still extremely low. I think according to this, one of the lowest first dose vaccination in England. I mean, obviously, I know there are various reasons, and the dynamic within the borough we live in is different, but surely we're not unique. What needs to be done, and what can be done to make sure that people get vaccinated? Are we doing enough? Because I am concerned that we are still at the bottom of the league. Thank you.
Do you want to answer each question individually, Chair, or do you want me to collect a few?
I've got three hands, so actually let's take three together. Councillor Snell.
Mine is really to follow up what Dennis asked. I understand the best practice is for GPs to contact the people who've not come forward or who haven't done the boosters and start talking to them personally. It would seem to me sensible, particularly with the youngsters who seem to be just not bothered to get vaccinated, that we had some way of recording what those GPs are finding, and then that would allow us to target our message more effectively. So I just wondered what was happening on that front.
Councillor Adams.
Thank you, Chair. My question is on the testing rate, the decline in testing rate. Sorry, if people are not coming forward to be tested, so what do you make of the statistics that we're getting every day about the infection rate and so on and so forth? So I don't know. Does that make sense?
Declining testing rates, and
yes,
what we read into that.
Yeah, and the stats that we get every day that this X number of people have been infected, which is So it's not actually reflecting the true figure. People are not coming forward to be tested.
If less people are coming forward.
Yeah.
Okay. All right. Have you got those, Chris?
Yep. So I think the vaccination program continues to have a huge amount of effort locally across City and Hackney, both the local authorities and NHS partners. You're absolutely right. We have got one of the lowest uptake rates, and hesitancy around vaccination is something that we are addressing slowly and increasing people's confidence in the vaccination program. But unfortunately, at the same time that we've probably now got people more confident to come forward for vaccination because it's safe and effective, there is going to be, I think, a difficulty in cutting through that message, essentially that, you know, we are removing all the COVID restrictions and that this is now going to be returning back to normal. Obviously, we've seen with Omicron the importance that, you know, new variants can come very quickly onto the scene. They can very quickly spread across the world. And that really does speak very strongly to the fact that we do need, you know, across the whole of the world to look at vaccination uptake. And obviously we compare very favourably to most countries, but certainly in the areas of Africa and some areas of Latin America, the vaccination rate is much lower. Just in terms of one of the things that I think we would almost certainly benefit from is greater access to vaccinations. People at some point, hopefully the vaccination program will be rolled out to GPs the same way that the flu program is. If you give people better access to the vaccination program, you know, at practically every community pharmacy and every GP practice, which is what we have for the seasonal flu vaccine, that would almost certainly improve vaccination uptake. But that's not locally in our gift. It is NHS England who decide upon which vaccination centres are authorised. But in the short term, I think the work that we're doing with communities and also the vaccination pop-up programme, you know, is proving to be successful. Absolutely right in terms of highlighting the importance of GPs and call and recall. I would have to get back to you about exactly what's happened in terms of the booster program. Certainly, previous to this, I was very aware that there was a very extensive call and recall program, and that GPs were calling people who hadn't come forward for vaccinations and were having conversations to try and improve confidence in getting the vaccination. But as we know, you know, that conversation from a trusted health professional can be really important, and a lot of that has already taken place. And then just the final one around in declining testing rates. There has been some difficulties in accessing testing kits in terms of lateral flow test kits. There is obviously been that significant change is that people don't need to get a confirmatory PCR test. Not everybody reports their lateral flow tests and positive lateral flow tests. We're not alone in seeing a decline in testing rates, and people, there is still, you know, fairly widespread recommendations that the list of COVID symptoms in most countries is now much broader than the ones that are still recognised in this country, so that actually in a lot of countries, cold-like symptoms are often a trigger for testing. So there almost certainly is people who have not come forward, you know, for testing, either because, you know, they've got symptoms which are not currently on the list of COVID symptoms in the UK, but maybe elsewhere. But actually the most reliable is the ONS survey that's done quite regularly, because that actually tests people regardless of symptoms, and that gives an indication. The R rate, I think, in London is just hovering slightly around 0.9 to 1. Anything above 1, you're likely to get increasing infections. So I think the partnership approach is definitely really, really important, trying to keep that focus on you know, how we're going to be responding to COVID. If we are going to be having those really significant national changes, which are likely to be announced in kind of the last week of February, it won't give us a huge amount of time to plan as to what that will mean for all elements of the system. But I very much hope that the vaccination program will continue throughout the period, even if there are significant changes to requirements for self-isolation. But maintaining that vaccination focus is going to be really important. And then obviously in the winter period, for next winter, autumn, September, time, there may well be a move to a more mainstream approach to COVID vaccinations as with winter flu. Thank you.
Thank you, Chris. That's very useful update. Are there any further questions? I mean, one thing that was just going through my mind there is, I mean, in other places, there's sort of is slightly off point really. There have sort of been discussions as to Hackney's sort of relative inequality gap compared to other places, and how, say, the funding coming down from local government settlement in future years might change, whereas Hackney's typically done fairly well because of the inequality gap. But if you look at the health data, and we're still one of the lowest level of vaccination take up, and it very much appears on a health analysis, just looking here, that we still have some of the highest inequality health outcomes in the country, in terms of if you were to use sort of metrics of vaccination uptake and population challenges. Would you agree that from looking at the health data, we're still one of the most challenging areas in the country?
I mean, I think the data does speak, very much for itself in terms of vaccination uptake. In terms of things like long COVID, there is more information coming forward. There is needs assessments that are being undertaken, and I think that's going to be something that we will need to keep a close eye on, in terms of the fact that COVID, even if we change significantly our national response, locally you're still going to have to be providing treatment and care, focusing on those people who are particularly at risk of complications. And as we know, a lot of those people may not have completed the full vaccination course, and it's just making sure that we've got that focus to make sure that health inequalities are not widened because of all of the structural and deprivation issues that we have, and we know do make a huge impact. And we're not alone. It is, if you're looking at the areas with the lower uptake of vaccination, it is areas with larger ethnic minority communities and deprivation as well. And the response to that is often about making it even easier for people to access the vaccination uptake, and that's something which certainly we know has been successful in other vaccination programs, is making it as easy as possible. If we do move to a much more locally planned program without so many of the national, all of the vaccination, for example, for community pharmacies, has to be approved by the national team. If that becomes much more of a business as usual, as with seasonal flu, it will almost certainly make it easier for people to access the vaccination in a low threshold way.
Thank you, Chris. That's very helpful. We're bang on 9, so with that, I'll wrap that item up. Thank you very much, as always, Chris. So minutes of previous meeting, members, can I take them as agreed? Thank you. Work programme is at the end, and I think we were just discussing in the pre-meet that we maybe finish the meeting, the actual public part of the meeting, sort of 20 or 30 minutes earlier in the March, and we can have a discussion about future work programme ideas. I haven't been notified of any other business, so with that, I'll close the meeting. Thank you.